Hi everyone, or anyone who is watching this video. Hello. Today I'm going to discuss about third degree AV block. We know that in the EKG, the P waves do not follow the QRS. There will be lot of dissociation, and this is the one that could lead to complications. It is really bad one. Sometimes there can be death if we do not treat it promptly. As the name suggests, there can be blockage in the AV conduction. So the investigations of choice include lipid profile. When do we do lipid profile? Why are we doing this? Firstly, to rule out MI, because this is one hypercholesterolemia can lead to MI. Yes, so this is one important thing to remember, and then always do Lyme disease. At this point, we can go ahead and remember L for L, lipid and Lyme serology. Make sure to do ESR because there can be inflammatory pathologies like myocarditis, sarcoidosis, amyloidosis. So remember the DDs, because if you remember the DDs, you're likely to order the test. A for amyloidosis, S for sarcoidosis, and M for myocarditis. So, what is the definitive treatment of choice? Pacemaker, transvenous pacemaker, or let's say transcutaneous. For the temporary basis, you can do anything. Soon after, the patient can be transferred to surgery for permanent cardiac pacemaker. So before we take a patient to surgery, like any other protocols, we will follow the routine pre-surgical measures like NPO, PT, PTT, INR, blood group, cross match. Finally, we want to note the pathology behind third uh, degree AV block. So we can think of MI patients. Post MI, there can be arrhythmias, right? So this is the MI patient. Or if the patient is very young, you can think about congenital AV block. Okay. And there can be situations like aged individuals. Now, in aging, it is most likely because of non compliance to antihypertensives. Always document the history if they are taking antihypertensives on time, um, so, so that they do not have any complications like this in the future. And then finally, it can be iatrogenic with the overdose of beta blockers. So usually the patient will present with a very low heart rate, dizziness, syncopal events. So it is treated in the ICU settings. Sometimes it can happen with Increased vagal tone. This is also important. Or calcified vessels can cause it. There are other electrolyte abnormalities like hyperkalemia. In hyperkalemia, we want to remember the ECG findings, prolonged PR interval, inverted T waves, and sine wave pattern. You should also think about TSH. TSH thyroid abnormalities. Um, Both the hypo and hyper can lead to our AV node blockade. All right, this is a very short video, and you just have a very few points here and there to remember. So that's it for now. Thank you, and I will see you in the next video.